Hi there, everyone. Now, I'm joined in the studio by Kees Hertogh. Kees, how are you?
Good to be here, Sarah.
Oh, no, great of you to join us. Now, you're here to talk to us about how AI is transforming public healthcare and the healthcare and the public sector, which is actually a huge topic. So, what are the across all of these industries, and you can take them one by one if you want, because, education, government, healthcare, what are you seeing as the biggest opportunities for AI?
Yeah, I think it's what's more important what our customers are seeing. And I think they're not seeing AI as just a technology. They see it as a way to really advance their mission. And they want to make sure they can scale AI compliantly. So they're asking us, hey, how do I make that happen? And lastly, they're looking at their investments across the platform as well as scaling, kind of on a long-term basis. And for each industry, it's slightly different. If we look at education, there's an opportunity, of course, with the teachers, and how do we accelerate and make the teachers the hero? But also, how do we get more personalized learning in place? Learning is changing in the industry, AI is changing learning. So what can we do to accelerate and make it more personal for the students? If you look then at government, across all the different government agencies, from state and local government to federal, they're looking for ways to really augment their workforce. How do we can use AI and agentic AI to really get more out of the workforce and get more productive? With an eye on citizen services. How do they serve their citizens better? As citizens are expecting a more digital-first engagement these days. So that is often the questions we're getting, and starting with the citizen services, how do I do that? And lastly, they're sitting on a lot of data, so how do we get more out of the data? Lastly, in healthcare, where healthcare AI is probably one of the most important innovations we're doing, and healthcare may be one of the most important priorities for us to pursue. So how can we really advance diagnosis in healthcare? And with that, kind of improve the patient outcomes. And lastly, I would say in healthcare, how do we address the workforce, certainly on the clinical side, the workforce shortages across physicians, nurses. We can do better, and a lot of our customers are looking at addressing things like workforce burnout, doctors losing or maybe want to exit their job early, and AI is getting them back because there's in healthcare, there's a terminology called pajama time, which is a bit weird. It's like people at night trying to make up clinical notes. And how do we cut back on pajama time and really get them in front of the patient?
Yeah, in fact, that's funny. I have a friend who's a doctor who spends a lot of time doing that in the evening. So I didn't know it was called that. So as organizations are adopting AI, all organizations, of course, face challenges, but of course, these sectors that you're looking after, they're highly regulated. So what are the specific challenges that they have that other organizations might not have?
Of course, they have to do everything with compliancy in mind and sovereignty and data sovereignty. It's important across all the industries, but certainly these industries, data sovereignty is top of mind. And you can imagine, there's a lot of regulation from HIPAA to maybe the EU AI Act I have to deal with, and how do I do that? That's one element. The second one, I would say, security. If you look at, for example, education and healthcare, vast trove of data with a lot of PII.
Oh, yes.
A favorite target for cybersecurity or people to go after these data sets. So cybersecurity is critical in those industries. And kind of paired with the last one, maybe the lack of investments in the core platform. A lot of aging infrastructures, disconnected data sets. If you look at healthcare, for example, 80% of the data is still being unused. And it coupled with a lot of these industries are kind of tight on budget. So they're not, so they're still looking for funding or getting their budget in order. And in the meanwhile, they're under attack. So those are some of the key challenges that are in these industries that kind of withhold them for getting the data in order, making sure it's secure, and then really benefiting from AI.
Yeah, and I would say, yes, as a security person, I'm definitely very interested in how my my PII, my healthcare data, all of those things is being used and stored.
Yeah,
So.
and it's like even for schools and kids, they're same thing.
Yeah.
School systems are not always funded to get the security protocols in order and the security practices. So that's, while we talk about AI, I think it starts in these industries with the basis of security.
Yeah, I couldn't agree more with you on that one. So how is Microsoft helping customers and partners move from, say, a pilot or a theoretical thing? Because, of course, this sounds great, and everything we see on our announcements sounds amazing. But how do you get to, like, some real-world results with that? Yeah,
real world is important.
Yeah.
Like I said, there's a lot of potentiality in AI, and certainly Gen AI has advanced and accelerated some of that. And we see excitement across our customers. But I think it goes back to we're making some additional product investments. If you look at, for example, in not just for government, but important to government, all the work we're doing in sovereignty and data sovereignty. Very, very important. Of course, following through on the AI Act in Europe, but making sure that we keep our customers and government organizations in control of their data and their sovereignty. So those are very important investments that we're making kind of across the board as kind of key IP investments for government. Secondly, in education, I think some of the investments we're making, even recently, we introduced some new teach capabilities in M365 Copilot that allows a teacher to really generate a lesson plan with Copilot. And maybe generate cue cards for students. So really helping the teacher with their task and productivity by using M365 Copilot. We're very excited about that kind of new AI innovation that we can bring to the teachers. And looking at healthcare, where the problems of AI and Gen AI, like I said earlier, is maybe one of our most important priorities to break through and focus on a better health. But we also have to do it from the bottoms up. So even today, we released specific AI models trained on imaging and medical imaging for chest X-ray. So we put them on the Foundry catalog. And it helps using Gen AI to really, because if you're looking at a picture, a radiologist has to look at a picture. It's basically looking at a Polaroid.
Yes.
And how can we help? And AI and Gen AI can help that radiologist, for example, really understand what things that a human eye can't see. And optimized models on medical imaging, for example, is one of those foundation capabilities that we'll bring into our core AI platform. But we're also kind of very excited about our investments that we made in Dragon Copilot. So again, a Copilot specifically for the clinical side. We saw Epic this morning, we're partnering with Epic. Seth Haynes referred to it, the integration we have between Epic and Microsoft Dragon Copilot to provide a clinical assistant for physicians and nurses so they can really focus on the patient interaction versus hiding in the screen. Probably all had that experience that if you meet your doctor, they hide behind the screen and to capture their data. With things like Dragon Copilot, we're using ambient AI technologies and Gen AI technologies to basically put the mic on the desk and let it listen ambiently to the conversation and automatically generate the clinical note. So those are some of the core fundamental IP investments we're making across these industries to help these customers in their journey.
Yeah. So I have another friend in the healthcare sector who loves to write up notes with AI because I think it saves them a lot of time.
Yeah.
So, Kees, can you tell me maybe just one more, maybe just one example, like a recent success that you've seen in adopting AI in the public sector? Yeah.
I think, funny enough, NVIDIA just now, or Seth had a section with the city of Raleigh, and I watched you to the session how the city of Raleigh can be really a successful or more engaging community. But let me call out specifically some work Stanford healthcare system. Again, in healthcare, there is this thing called a tumor board, which is a meeting between specialties to look at all the different cancer cases. And we announced something with Stanford at Build this year, where they use a multi-agent capability. Because since COVID, most of these tumor board meetings happen in teams. And get the help of agents and multi-agents to reason about all the patient data, the imaging, et cetera, to get a more effective case diagnosis and a case follow-up on some of the most critical cases in cancer diagnosis.
That's really awesome. So, Kees, last thing, where can people go to learn more?
Where can we learn more? We have a great link, aka.ms, AI use cases.
Awesome. Well, Kees, it's been wonderful to talk to you. Thank you very much. And we will leave it there for now. Thank you.
Thank you, Sarah.